Like, let's just look at it. If you don't take your medications, you only get worse. So it's better to just face it and accept it. It's going to take a process. J5. Hi guys, welcome to my YouTube channel. I'm Dr. Hilda, and my YouTube channel is about health and lifestyle, where I give you tips on common health conditions and I share interesting aspects of my life, making vlogs and the rest of that. If it's your first time here, I hope you enjoy my channel. Join the family by subscribing to my YouTube channel. Yeah, let me give you a second to do that. Thank you for subscribing. So in today's video, I want to talk to you all about coping with chronic illness. We all know that, okay, we don't all know. A lot of people that have been through this will understand what I'm saying. When you go to the hospital and the doctor tells you have a certain illness that sounds scary, and they tell you that you would have to take medications for a very long time, or you have to take medications for the rest of your life, it can make us feel a certain way, in denial at first. Maybe you just hear that you're HIV positive or you have diabetes, and these conditions will enable you to take medications every day of your life to be okay. It can be very tiring. It can be a lot to take in. So conditions like diabetes, where you have a metabolic problem of controlling your blood sugar and it's constantly high in your blood, and if left untreated or unmanaged can cause complications. Hypertension, where your blood pressure is high. HIV virus, where the virus is just in your body. You cannot really bring it, you can't kill the virus, you just have to suppress the virus so your body is not suppressed. Or hepatitis B virus, all these major illnesses, chronic kidney disease that you do not have a certain cure, but you just have to manage. It can be a lot. So people go through different phases. The common problems that people face, they will go through denial. That's the first thing. They go through denial. Like, imagine you just living a normal life and they just tell you one day that you have this illness, your life is going to change, you can't eat a certain meal, you have to take these medications, you have to do this, you have to do that. It can be a lot to take in. Some people will not just believe. I encountered a woman who was diagnosed of breast cancer and was told to come to the clinic so a biopsy will be taken. But she was in so much fear and denial that she didn't show up to the clinic for months. And during this period that she stayed away, the lump kept on growing and spreading to other parts of the body. People with chronic illnesses that have to take medications every day also go through depression, having to take these pills every day. You feel like your life, other people are living normal lives, you just want to live a normal life. Taking pills every day, it's really not easy. Some of them also go through things like drug addiction, let's say in sickle cell anemia, where they have so much pain. I mean, it's not their fault. They have so much pain and they just have to be taking these pain medications. But with time, they realize that they are dependent on the medication. Like, even when they don't have the pain, they just want to take that pain medication just to give them that good feeling. So there are a lot of things that people deal with, the psychological aspects, our body. There's also the aspect of non-compliance. That is, they are not able to comply with the regimen, with the dosing. That is, if we say take these medications every morning and evening, they are not able to be regular on these medications. So these are things that when we go through them, they'll actually worsen our conditions. I'll talk to you on ways you can help to avoid these problems or tackle these problems that people that are taking these medications or have chronic illnesses go through. So first off, you need a psychological therapy. You have to tell yourself that really it's not the end of the world. I know when you are told this thing, like you are given a diagnosis that sounds so scary, and someone tells you it's not the end of the world, you're like, what's this person saying? Like, it doesn't make sense. Like, your life is changing, I understand, but it's really not the end of the world. If you take your medications, you'll be fine. Like, let's just look at it. If you don't take your medications, you only get worse. So it's better to just face it and accept it. It's going to take a process, and you should get all the help you need. And this brings me to my next point: social support. Nothing beats having a good support system. People that are around you, care for you, remind you to take your drugs, help you to live a normal life by having fun together, just living a normal life, not being isolated. Because if you're isolated by yourself, you tend to think about this condition more, and you'll be sad and be going towards the path that you shouldn't go through. Like, you should be going up and not going down. We have people around us, parents, family members, siblings that have chronic illnesses that require them to take drugs every day. We should try to be there for them, try to encourage them to take these medications, remind them to take these medications. You can have talks to them, tell them it's not the end of the world. This really goes a long way. Like, it really goes a long way encouraging them. So try to also create fun activities. Like, it's not just all about that thing, that aspect of your life. You still have your life going on. You just have to try to take your medications. So dealing with the non-compliance, it's very hard to have to take a pill every day, twice every day, or even 3 times every day. It's hard because you have your normal life. You might wake up and want to go to work. You might wake up and forget. You might be out of your pills and the rest of that. Measures you can put in place to ensure that you are compliant with your medications. First off, you can set reminders on your phone to remind you on taking your medications. You can also have like a calendar where you go for your monthly or weekly, depends on your medication that you're taking, monthly drug review, so you don't run out of these medications. Because if you run out of medications, that's what leads to compliance. And when you miss one, resume, miss again, becomes a pattern. If you just get used to taking it regularly, even the day that you forget, your body is going to remind you, your brain is going to remind you, okay, you're taking this medication and this is the time that you should take it. So dealing with drug addiction, especially for pain medications, if you notice that you're becoming dependent on a drug, you don't feel any pain, you don't feel any symptom, you just want to take the medication for non-medical reason, maybe just to make you happy or relax, and you're not taking it for the medical use of the drug, you might just be addicted. What you should do is talk to your doctor. I just want you to know that if you're going through a major illness, a chronic illness that has no cure, it's really not the end of the world. Some people are even scared of starting on the medication. They're scared of the side effects that can occur. Like patients that I see that are hypertensive and are scared of starting their medication, antihypertensive drug, I tell them that hypertension will kill you faster than the medications you're scared of taking. That is, when you come down with complications like stroke, chronic kidney disease, those are things that you do not want to go through because it's really a lot to deal with. The medications they're not going to cause that harm to your body compared to the complications of the disease that you have. That is, the benefits of taking the drug outweighs the risk of not taking it. If you have a chronic illness, get all the support you need. Surround yourself with so much love. Make your life comfortable so you don't have additional stressors that can tilt you to coming down with depression and the rest of that. And I've come to the end of this video. Thank you for watching to this point. Please subscribe to my YouTube channel if you're yet to. Also give this video a thumbs up if you haven't, and if you enjoyed watching, leave your comments if you have anything you want to share with me. And you can also check me on Instagram. You can discuss with me your health conditions. Like, just feel comfortable and join the community. Thank you for watching, and I'll see you in my next video. Bye. Go, go, go.